A question that I had recently from a doctor who had been practicing 20 years. He said, I'm a very happy dentist. I have a very successful practice, and I have a lot to share with younger dentists. But his question was, how do I blend a very busy practice with developing a speaking career on the side? And my advice to this doctor was that it is very difficult to have a dual career, and if you're a good speaker and you bring great audiences, then this business can be very seductive. So don't be surprised if you're not in demand and your speaking career grows more rapidly than you might have imagined. It doesn't always happen that way, but in this case, it could. So the question is, do you have someone else who could come in as an associate doctor and share the time in your practice, which would allow you possibly to go to a 3-day work week? And if you could devote 3 days of your practice and work 12 days in office and 4 days a month as a speaker, this would give you 16 work days, and you would have coverage in the office when you were away. So whether you choose to speak on a part-time basis or a full-time basis, at some point later on after your career in speaking develops, then you may have to make a decision of whether you want to sell the practice and speak full-time. Or if you're tired of the travel, you may say, well, I think I'm going to go back into the practice on a full-time basis. But most dentists who also speak realize that the travel is not easy, and being away from their family, a lot of major meetings are on the weekends. And so you really have to weigh all the pros and cons. So if you are a happy dentist and you have a lot of success in your own practice, I really am happy that this person wants to share that knowledge, and this is his way of giving back to a profession that has brought him a lot of joy.